And so what's a normal level of nitric oxide? So the American Thoracic Society on the left gives us this little tool to use. It's kind of low, medium, high levels of exhaled nitric oxide. You'll notice that there's different levels depending on age. So what's normal for adults is less than 25. This is parts per billion. So less than 25 is normal. Between 25 and 50 is kind of borderline, and then above 50 would be a high level of nitric oxide. For adults. And children, it's just a little bit lower threshold. So above 20 is, or I'm sorry, below 20 is normal. Between 20 and 35 is borderline. And then above 35 is elevated. And so on this tool that we can use for kind of management of asthma to some extent, you can see on the left-hand column we have symptoms are absent, symptoms are present, but maybe not frequent, and then we have frequent symptoms. And so we can kind of use symptom frequency along with ENO levels to help guide clinical decision making to some extent. So if someone down here in the lower left quadrant is not really having any symptoms, their ENO is normal, that might be someone that you could back off on their inhaler therapy a little bit and see if they do better. Conversely, someone in this right upper segment where they're having really frequent symptoms and they have a really high ENO, they likely have a lot of T2 inflammation in their lungs. They might benefit from increasing their inhaled corticosteroid. On the left-hand side here, if they have frequent symptoms and their ENO is normal, maybe it's not type 2 inflammation that's driving that. Maybe there are alternative diagnoses. Maybe there's other factors involved in their symptoms. And then if they have a high ENO, despite having not a lot of symptoms, maybe they're not taking their medication correctly. Maybe they have poor adherence. But if you take away inhaled steroid in that patient, they're more likely to develop problems. And so kind of this gray, not gray area, but more of your clinical decision making where you're taking into account multiple factors probably happens in this yellow area where either symptoms are frequent or ENO levels are kind of borderline. And so what do we do with that? So we need to know both the absolute level and the change in ENO levels when we're considering what to do. So if you look at, again, the American Thoracic Society guidelines, they say that a change in ENO after intervention with an inhaled steroid might be more relevant than the absolute ENO number itself. So I can give you an example of that. I just saw a patient last week who used to be a dog groomer, and she was highly allergic to dogs, and her exhaled nitric oxide levels would hover in the 230 to 250 range, and she would have ongoing symptoms despite kind of maximizing her inhaler therapy. And then she retired, and once she got away from being around dogs so much, the same level of inhaled corticosteroid was enough to keep her symptoms under control and her ENO level reduced to 65. And so although 65 is still considered elevated, when you compare it to her baseline around 230 or 250, that's a pretty substantial decline in that level. So also the reverse is true. A rise in ENO of over 40% should be interpreted as a high ENO level. So we use this, I said, to measure inflammation in the lungs, and exhaled nitric oxide does correlate with other markers of lower airway inflammation, particularly lower airway eosinophils. And so there are other means of measuring eosinophils in the airway. You can induce sputum, you can do bronchoscopy and collect bronchoalveolar lavage fluid, but offers a validated way to assess this in a less invasive fashion, and so it's easier for patients and it's lower risk.